Good morning to my respected guide, all my respected colleagues and seniors. I am Shangita Mukherjee. Today I am going to present the preparation for the progress of my thesis, and my guide is respected Professor Dr. Alka Ravekar. The title of the thesis is Evaluation of Knowledge and Perspectives of Medical Students and Teachers on Physiology Electives, a mixed method survey study in a rural medical college of West Bengal. Introduction. A new competency-based undergraduate curriculum, it has been undertaken by NMC, and this new curriculum has initiated elective module first time in India. The objective of elective modules, it was mentioned as learning experience created in the curriculum to provide an opportunity for the learner to choose the future path. The total duration of elective is 1 month. It was split into two blocks, block 1 and block 2, each having duration of 15 days. In block 1, pre and paraclinical departments like anatomy, physiology, they are included. And in block 2, clinical broad specialty, super specialty and community clinics are included. It was imparted at the end of phase 3 part 1 and before the beginning of phase 3 part 2. So regarding the certificate, on the left hand side I have the Institutional Ethics Committee certificate. It was given on 16/4/2025, and on the right side I have used a tool for checking the plagiarism. It is less than 9%. Now, need of the study. We all know that basic science and clinical syllabus both prevails the strongest basis for medical curriculum. But little is known about the concern of students about the electives allotted to basic science departments like physiology, especially in rural medical colleges in West Bengal. So one previous publication on it is there, but it was done in a Calcutta-based medical college. That is the effectiveness of pulmonary function test as effective module among undergraduate medical students. It was done by Debanjana Choudhury, Arunima Dotto. It was published in IJPP, and their finding was the implementation of the elective was successfully done in their department. Now, what are the gap in their research was knowledge gain. They have not mentioned about the interpretation of the clinical data, both normal and abnormal, gain of communication skill with the patient, peer, co-staff, learning how to maintain privacy while doing the clinical test, gain of psychomotor skill of performing the clinical procedure hands-on, perception of teachers on these modules, and opinion of the students and teachers on positive, negative points and the suggestions to improve in future. So the nature of gap of knowledge, it was cognitive skill that was deficient, interpretation of normal and abnormal reports, psychomotor skill, how the hands-on procedure it was done, communication skill with the patient, peer, non-clinical staff, and how to maintain the privacy, and the perceptions or opinion of the students and teachers about the module. Research question: whether participation in a structured elective module of physiology, it can improve the gain in knowledge, clinical skill, affective domain and confidence of MBBS phase 3 students, and what are the students and faculty's perception of the module. This is the research hypothesis. The null hypothesis is that if these modules, they have no significant effect on the knowledge gain undergraduate medical students, on their perceptions and practices of clinical skill, it has no impact. Teachers' perception is also skeptical. The opposite is the alternative hypothesis. Now, research design, it is a cross-sectional mixed method questionnaire-based study. Study duration is November 2024 to September 2025. Study area is Physiology Department, Rampurhat Government Medical College. Study population, whole 30 students who enrolled for the physiology electives, and inclusion criteria also a whole 30 students who enroll for the physiology elective. Exclusion criteria if any student does not give consent or absent. So this is the study module. So in our department, two elective modules have been given. One is a PFT, another is the ECG. So immediately prior to starting the module, they have given a pre-test, and after that they have undergone the 2 weeks schedule of elective. Pre-test score versus post-test score, it was observed after the end of the module. Then there was a pre-validated questionnaire was given on the Likert scale, and few open-ended questions were also there. So perception of the students were also taken. Then the thematic analysis of their perception was also calculated or measured. Teachers' perception was also taken by a validated questionnaire. And to strengthen the report of the survey, one focus group discussion was also held. Aims was to assess the perception of students and teachers regarding these two elective programs. It also tried to elucidate the knowledge gained by the students at the end of the electives. Now this is a sample size calculation. Purposive sampling with complete enumeration technique or census, it was used in all the students who enroll for this physiology. This is a sample size formula, and where the Z is a Z score 1.96 and 95% confidence interval, and D is the desired margin of the error. On the basis of the 5% margin of error, 95% confidence interval, 1% outcome response, and the estimated sample size becomes 16. If the population is 3000, that is total number of students under WB West Bengal University of Health Science eligible for electives, including rural in and urban medical colleges. Sample size of the present study is 30. So this is the study module what they have done. Department of Physiology have been given two modules. One is the ECG, another is the PFT. So in the first week, other than pre-test, lead placement, how to do the procedure, how to maintain the privacy, especially in female patients, this was done. In the week 2, they were gone through about to measure the heart rate, axis, and overview of arrhythmia is also given, and abnormal ECGs have been shown and asked them to identify. And PFT, regarding PFT program, we do PFT in our test, the patient service. So first, in the first week, they had the first the theory introduction, then they observed the test, they explained the procedure to the patient, then they did the data entry, that is weight, height, and all other things by themselves. In week 2, they performed themselves hands-on, 2 patient per student, and they observed the reversibility test, learned about it, and interpretation of at least 5 spirometry data. After that post-test, they maintained a logbook, and each group they have given a PowerPoint presentation and scoring was given on it. Now the material and methods. Students were assessed immediately prior and shortly after their elective experience by pre-test and post-test questionnaire. It was prepared by the subject experts of Physiology department. After explaining the purpose of the study and taking informed consents, online survey was conducted. It was done with a validated questionnaire, which was developed by the author after a series of students and staff focus group discussion. It was this questionnaire was also validated by 3 experts in the field of medical education. The questionnaire was anonymous, self-administered, English language questionnaire, and it used 12 survey items. Out of the 12 items, 2 items was on the demographics, 10 items seeking students' responses on the 5-point Likert scale from strongly agree to strongly disagree, 1 item concerning about the reason they took PFT and ECG as elective, 3 items were the open-ended questions asking participation for their participations for their opinion on strength, weakness of the program, and the suggestion to improve it. An online Google form was used to create the questionnaire, and all participants were sent the link via email or WhatsApp group. Then we did the FGD, one for each batch. It was carried to gather the qualitative data. Focus groups were formed randomly with 10 students each from the ECG and PFT electives. Discussions for each group were scheduled as separate 1-hour session. The sessions were audio recorded and decoded by one of the members of the research team. Analytical process done by using verbatim transcription and recognizing the participants' impression. Participants were informed of the session being recorded, and verbal informed consent of the audio taping was procured from all participants. They were fully autonomous and had the liberty to leave the study as they preferred. A qualitative content analysis was executed according to Granham and Lunham method. Each data unit was condensed and allocated a code. All coding and categories recognized were arranged in research members to confirm the iterator readability. Subsequently, categories aroused was grouped from the codes. They were grouped, and lastly, a general theme was employed for these categories. Another cross-sectional questionnaire survey was conducted among the faculty members. Statistical analysis was done, Microsoft Excel 2007, for data entry, and thematic analysis was used to examine the qualitative data, and proportions were reported as percentages. For FGD, every member of the analysis unit reviewed each group of transcripts separately, noted keywords, phrases, and major themes, both in response to the specific questions asked, and they spontaneously emerged from students' comments. The responses was then entered into Excel database with each data sheet in a file being used for each question of FGD. The coding column was filled during the next phase of analysis, where the categories were synthesized both by deductive and inductive process. So this is the result. In result 1, we can see that 30 among the 30 students, 14 male and 16 female. Their average age was 23 plus minus 1.18 years. Attendance was 100%. Out of these 30, 26 students, they took ECG and PFT as their first choice, and 4 of them took as a second choice. So here we have given the QQ plot, and we also did the Shapiro-Wilk test and Kolmogorov-Smirnov test to see whether the p-test and post-test score, they are normally distributed or not. So from this it is obvious that they are normally distributed from the result of this. So we did the t-test, parametric test. The result of the t-test, this is the amalgamated result. Both ECG and PFT, pre-test and post-test score, it was significantly positive. P-value is significant. So there is significant knowledge gain. And we also did the individual pre-test and post-test for ECG and PFT. In both the cases, the result was, P-value was significant. This is the result for ECG. This is the result for PFT. Now this is the questionnaire survey. Majority of the students, they were satisfied. What they expected, it was fulfilled, and they had adequate hands-on experience, and they have developed good communication skill with the peers. They learned about how to maintain privacy of the patient and also how to behave with the co-staffs, and so these are the graphical representation on the right side of this their perceptions. Now regarding the responses of the students, the thematic analysis, that is it is saying that 48.28% they said that why they took this ECG and PFT, because they wanted to learn the topic, because it will help them to become a good clinician. Then 37% they told that clinical application is very important. Others told that I was interested in this topic. Then the what are the positive points that is done by the thematic analysis? It was, the sub-theme was clinical exposure, and the diagnostic skills, I wanted to learn the topic as it will help me to be a good clinician and diagnose the patient. Generalized positive response, that I wanted to have an hands-on experience. Knowledge expansion, I wanted to learn about it. And practical skill, I wanted to learn about the procedure of interpretation of ECG and as well as PFT. So these are the positive points they have mentioned. Negative points, that they needed the content overload was one cause, that abnormalities of PFT and ECG, it was tough. General issue was they needed more time. That is 46.43% students told that it more time, and 26% also told that this 15 days duration is a bit short for them. And insufficient classes, they needed more amount of clinical practice of the, especially for the abnormal ECGs and the PFTs. Now the perception about the what about how can we improve the program in future. So maximum students just stated that nothing to suggest, it was excellent. Now 32.14% suggested that the duration should be at least 1 month, and they needed required more classes on the abnormalities of ECGs and PFT, and no such suggestion was 10%. This is the perception of the teachers. They told that 66%, they told that the strength of this program, it lies there is individual one-to-one contact with the student, so the concept and ambiguity can be cleared, and it will help the students. 50% told that to have a taste of their area of interest, and it will increase the students confidence. In-depth study in these modules and hands-on approach, it is also a positive point. Now the FGD, we have divided the FGT into four themes. One is the necessity of elective modules of this ECG, then program satisfaction, deficiencies of present modules as perceived by the participants, and another is the improvement of the strategies. Now this was the response. First theme, necessity. Why it is necessary? I wanted to learn the procedure. I wanted to have a hands-on practice. Program satisfaction, I had opportunities to perform the test by my own and got chance to communicate with patient. Basic concepts that were clear, and clinical interpretation was also clear. Deficiencies, they told that only 14 days time is short, and more theory classes they needed to understand abnormal ECGs. Improvement strategy, the time can be elongated. Interestingly, one student told that there should be an arrangement for refreshment on the day of presentation. Discussion, students' perception was very optimistic regarding the elective module. They agrees with the studies, and electives provided the students with a scope to demonstrate their ingenuity and lateral thinking regarding the and this result is in accordance with the studies done by Van Breck, Brook et al. Regarding the implausibility of the program, most students responded that there were none. Harvey et al., Ramalho et al., and Bande Brook, Wu, Ginbach, and Agarwal reported identical findings in their study. Regarding the critical appraisal of the study, as it was a mixed method study, I did the MMAT criteria. So the research question was clear, data collection method were appropriate, and relevant integration of qualitative and quantitative data. Adequate interpretation and integrated results was done, and coherence between data sources and collection of analysis, it was done. So it was also done by the critical appraisal, that is evidence strength was moderate to high, applicability is moderate, bias risk is low to moderate, limitation is moderate, educational value is high. So regarding the strength, weakness, opportunity and challenge, so it is a mixed method design, so it provides a robust triangulation, statistically significant improvement and 100% attendance, positive perception, validated tools, and integration of focus group discussion. These are the strength. Short sample size, single institutional study, short duration, infrastructural repetitions, and lack of integration with other clinical departments, these are the weaknesses. Opportunities, we can increase more integration and interdisciplinary integration, and improvement of suggestions, for example, more discussion on the abnormal ECGs, and implementing elective across other preclinical departments. Challenges, faculty constraints, non-uniform infrastructure, resistance to curriculum change, and risk of electives being treated as formally without adequate supervision and feedback mechanism. Limitation, it is a single institutional study and a single batch of MBBS students. Including more batches and a greater number of medical college will give a better view. So this is a translatory component, educational objective alignment. So it ensures the curriculum relevance, supports the nationwide CBME implementation. Skill-based learning is important, that is also there. Active and participatory methods, it promotes the learner-centered pedagogy. Faculty development and engagement, encourages faculty ownership and scaffolding of practical learning. Improvement recommendations, provides a feedback, and thematic validation confirms the construct validity of elective modules. Now regarding the contribution of the project to the scientific literature, so obviously novelty in the context, because in the rural medical setup it is not done yet, not published. It was evidence based evaluation was done. Policy implications, we have got the feedback from the students, so we can implement those things. Pedagogical contribution highlights the transformative learning and validates the importance of hands-on experience. Faculty insights as perception from the faculty, which are often underrepresented, and recommendations for the curriculum design. So this is a bibliography, and these are my students. Thank you.